coming year. We're going to be going over the changes, some things to keep in mind, and some highlights and details of all the plans. These benefits will become effective January 1st and will be in place until December 31st of 2026. Something very important to keep in mind, open enrollment begins on November 17th and will be open until December 5th. December 5th at midnight, the system will close and we cannot make any extensions as we are switching carriers. So we need to have all information and documentation in place by December 5th, the absolute latest. This is a time where you are able to go over your benefits, make updates to your benefits, make changes, update your beneficiaries, add or remove dependents, and select your benefits for the upcoming year. Normally, once open enrollment closes, you are not able to make any changes and you are locked in for the entire plan year. There are a couple of exceptions called qualifying life events where you may be able to make changes. Some examples of what this might be are if you get married, if you get divorced, birth or adoption of a child, or if your spouse gains or loses coverage. If any of these events does happen to you, you have a window of 30 days to notify HR and make any appropriate changes to your benefits. We're going to be continuing with the same platform on Employee Navigator to enroll in benefits. Please keep in mind that this is a mandatory process. You must go into the system and select your benefits for the upcoming year. For returning users, if you forgot your password, we have instructions on how to recover your password and enter your account. Or if you are a new employee and registering as a new user, we have instructions on how to enter the system as well. We also have a new app coming to the Hamilton and Miller benefits system. So this is an application where you are able to look at everything having to do with your benefits in one spot. Further information will be shared about this app once it launches, but you'll be able to look over all of your plan information, any forms, any group information, anything having to do with anything in this presentation today and regarding your benefits will be available on this application. So stay tuned for any upcoming news, information, and details on how to access this. Here's just a quick highlights of terms to know. This is really good when you are reviewing the guide and going over all of this information when you're doing your enrollment process. If you need any refreshers on what these important terms mean, or if you need any reminders, this terms to know page is available to you throughout the year. So we're going to be going over the new medical plans. So they are going to be through United Healthcare. There's going to be 4 different plan options available. We are transitioning healthcare medical plan carriers. So there are a couple of really important things to keep in mind. If you have any doctor's appointments coming up, if you're scheduling anything, there is a very large transition of information that is being moved from one carrier to another. And although we're working behind the scenes to make this transition as smooth as possible, we want to operate with an abundance of caution, just in case there's any delay in the transfer of information or any delay in processing, and we want to make sure that nobody has any lapses in coverage. So if you have any doctor's appointments that you're planning on going to in the beginning of the year, we recommend to possibly wait an extra week or 2 and schedule it a little later in the month, just in case there's any processing delays. Same thing to be said about prescription medication. If you are on any maintenance medication or important medication that you need to be consistently refilling, if you can refill it as close to the December 31st date as possible, to make sure that you have a steady supply while there is that transition in care. If you are on an important maintenance medication, it's very important to go into the Employee Navigator system and look over the drug formulary of the new medical plan and make sure that that medication is covered within the plan and is within network. And if there's any doctors that you are going to that you want to continue to see, please check if that doctor is within network as well. So to go over the new plan options, we have option 1 and 2 on this page. These are going to be your HMO Florida only options. So if we have any employees here on the call today that are residences outside of the state of Florida, these plans do not apply to you. Options 2 and 3 would be the choices for you. But if you are within the state of Florida, you can select option 1 and 2. So these plans are for Florida residents only, and you can only receive care within the state of Florida. With both of these plans, you also do not have out-of-network benefits, so you always have to make sure that whatever doctor you're seeing is contracted within the network. With option one, your individual deductible is going to be $2,500, and for families, that's going to be $5,000. Once you meet that deductible, it'll switch into a co-insurance cost structure. The co-insurance will be 80%, 20%, meaning that United Healthcare will cover 80% of the cost of specific services, and you will be responsible for 20% of the cost. You also have a calendar out-of-pocket maximum. So this is your financial security on your medical plan. If you have emergency surgery, if you need to get high cost medical treatments, if you go to the doctor a lot throughout the year, if you reach the total dollar amount of this out-of-pocket maximum, United Healthcare will begin to cover 100% of all services. So this is your protection, your financial security on your medical care plan. So you can have that peace of mind knowing that you will never pay more than this total dollar amount throughout the entire year. This option here is a high deductible health plan. So almost all of the services on this plan are going to go towards that deductible cost. So you'll see almost everything listed here is that deductible and coinsurance split. And for prescription drugs, you do have to meet a deductible, and then you have a co-payment breakdown depending on what tier your prescription drug falls into. There's also a different cost for complex diagnostic imaging if you choose to go to a designated diagnostic provider versus going to a non-designated diagnostic provider. The way that you know that these facilities are a DDP facility is when you're going on the United Healthcare application or website. If you see a little green check mark next to the name of that facility, it is a DDP facility. It's kind of like a network within your network of exclusive locations where you can receive the same quality care for a slightly lower cost. Moving on to option two, this is also a Florida resident only plan. And with this plan, you have a calendar year deductible of $2,000 and a family deductible of $4,000. Co-insurance on this plan is going to be 90-10. So once you meet that deductible, those specific services will be covered at 90%. And your out-of-pocket maximum on this plan is going to be $4,500. And for families, that's going to be $9,000. You see a bit more co-payments on this plan. So you have co-payments instead of that deductible cost for primary care physicians visits, specialist visits, as well as urgent care and emergency room.
Call, so I've got my door shut.
Just a quick note, if anybody does not have their mic muted, please make sure to mute your mic throughout the presentation. So going down to inpatient care, outpatient surgery, and physician's fees, these are going to be that deductible and coinsurance costs that you see on the previous plan. And you may notice that on both of these plans, starting from urgent care down to complex diagnostic imaging, there's a little asterisk star next to the name, next to the cost of each service. That means that that service is also applicable for coverage through gap insurance, which we will see on a later slide. For prescription drugs, you do not have to meet your deductible. It's just going to be that co-payment cost structure, depending on what tier your prescription drug falls into. Once again, option two also does not have any out-of-network benefits, so you always have to make sure that whatever doctor you're seeing is within the network. We have instructions on how to do so on the side of the page here, and you can also always check if your preferred provider is within the network by checking through the United Healthcare application on your phone. Here's option three. This is going to be the first of the two national coverage plans. So if you are living outside of the state of Florida, this is one of the options that is applicable for you. As you may see with this plan, you have both in and out of network benefits available. So if you need to see a doctor outside of the network, you can do that on this plan. But whenever possible, we always recommend to stay within the network whenever possible. Once again, this plan has national coverage, so you can see any doctor within the country if you choose option three. Your calendar year deductible on this plan is going to be $5,000, and for families, that's going to be $10,000. Once you meet that deductible, the coinsurance will be 70-30, meaning United Healthcare will cover 70% of the cost of those specific services. Your calendar out-of-pocket maximum on this plan is going to be $6,350 for individuals and $12,700 if you are enrolling with yourself and dependents. Preventative care, like with all plans, is covered at 100%, and you have co-payments for things like primary care physicians visits, specialist visits, urgent care, and emergency room. Starting from urgent care down to complex diagnostic imaging, you do have that asterisk star, meaning that those services are applicable for coverage through gap insurance. For things like diagnostic labs and complex diagnostic imaging, there is a slightly different cost depending on what type of facility you go to. So for things like labs and complex diagnostic imaging like MRI, CT scans, whenever possible, we recommend to go to a DDP center. For prescription drugs, there is a deductible that you do have to meet. And once you meet that deductible, it will switch into a co-insurance structure for most of the tiers on this plan. Mail order pharmacy is available, and there is coverage for prescription drugs available if you do go out of the network. Here's the fourth and final option. This is another national coverage option. So anybody outside of the state of Florida or looking for coverage outside of the state of Florida, you may also choose this plan. With this plan, you have both in and out of network benefits available, but like with anything else that we look at today, we always recommend to stay within the network whenever possible. The calendar year deductible on this plan is going to be $2,500, and for families, that's going to be $5,000. The coinsurance, once you meet that deductible, is going to be 80-20, meaning once you meet your deductible, United Healthcare will cover 80% of the cost of those specific services, and you will be responsible for 20% of the cost. Your calendar out-of-pocket maximum on this plan is going to be $6,250 for individuals and $12,500 for families. Preventative care, like with all plans, is covered at 100%. And very similar to what we saw with option 3, you have co-payments for your primary care physicians, specialist visits, urgent care, and emergency room, and that deductible and co-insurance cost for those higher cost medical services. Here you see the biggest difference between going to a DDP and a non-DDP location in diagnostic labs. For if you need any diagnostic labs, try to always go to a DDP on this plan, as it can be $0. It's always going to be a lower cost if you're able to go to a DDP. It's kind of similar to how you have lower costs associated with staying within the network. Gap coverage is also applicable on this plan, and you do not have to meet a deductible for prescription drugs. It's just going to be co-payments. And once again on this plan, if you want to check if your doctor is within the network or any facility you're going to is within the network, we have instructions on the side of the page. And once again, I highly recommend downloading the United Healthcare application on your phone. Everything having to do with your medical plan and your medical care is easy and accessible through that application. If you need to check the status of your deductible, the status of an EOB or a claim, if you need to check if your doctor's within the network, if you're not sure where to go to receive care, if you want to learn about different wellness programs, all of that information is available right there, easy and accessible on your phone. So here's some additional information in regards to some of the wellness programs that you have through United Healthcare. United Healthcare makes a big effort in making sure that you have additional programs to help support you through your health and wellness journey. So we have UHC Rewards. UHC Rewards is a really great program where you can earn cash rewards by doing simple tasks that hopefully you're already doing in regards to your health. So you can access this through the United Healthcare application, and you can earn cash rewards for things like tracking your steps, connecting your Apple Watch, going to your yearly checkup with your doctor, by completing a health survey, by going on a walk. Very simple tasks. You are able to earn rewards for a total of $300 per year. So once again, another great thing that you can access through the application on your phone. We also have Real Appeals, so it is a digital weight loss program. So if anybody is interested on going on a weight loss journey, or if you're having difficulties with your weight loss journey, you're not really sure how to go about your journey and you don't know what to do, this is a great program to get the additional support that you need. For any smokers that are looking to quit, we have Quit for Life. So this is a personalized support program that helps you quit tobacco. So it includes online resources, there is a mobile app, and if you are eligible, you could get medications that help with quitting smoking. So to access this, you can go on the United Healthcare website or the application, just like with anything else. And I really want to emphasize the importance of not only taking care of our physical health, but taking care of our mental health. So we have the Employee Assistance Program through United Healthcare. This is a really great program where you can get counseling and assistance, confidential 24/7 support with anything having to do with stress, anxiety, depression, relationship issues, financial issues, substance use. If you're having issues with your employer, you can reach out to this program and get additional support with anything that you need. And if you need additional support, if you need to be referred to someone else, these counselors can assist you with that. And also through the United Healthcare application, there are ways to find easy access to therapists. So if you want regular, more consistent therapy or psychiatric support, you can find whoever's in network and where you can go through the United Healthcare application as well. Lastly, we have OnePass Select. So this is a subscription program for memberships for different gyms and workout classes. So if you're the kind of person that gets bored just going to one gym, or you want to try out different places, try out different classes, this is a really great program where you have access to thousands of different gyms and different programs, as well as online on-demand resources as well. Like I had mentioned, we have gap insurance available for those who would like some additional dollar coverage on high-cost medical services. There are two different plan options depending on what medical plan you enroll in. They cover the same exact services, just the dollar amount coverage slightly differs depending on the plan. So with option one, this is compatible with the high deductible health plan. So that first option that we went through, the Florida only high deductible health plan, if you would like gap insurance, this is the one that you would select. You do have to meet a deductible before you can start receiving coverage on this plan. The deductible on this plan is going to be $1,700 per covered person. Also, something very important to keep in mind, if you do enroll in the high deductible health plan and select to enroll in gap coverage, you are not eligible to contribute to a health savings account. So you are limited there if you choose to enroll in gap insurance. Option two, you do not have to meet a deductible. You can automatically start receiving coverage through this gap insurance. So the way that these plans work is it's kind of like a bank account that you can pull money from to help cover the cost of certain medical services. You have your inpatient hospital benefits. So this has to do with anything having to do with staying in a hospital, surgery in a hospital, overnight stays, ICU, inpatient physician's charges. These are all things that fall under that category. We also have outpatient hospital benefits. So this is a separate bucket of money that you can pull from for things like radiation therapy, x-rays, MRIs, CT scans, outpatient surgery, kidney dialysis. You also have additional benefits through an enhanced outpatient benefit rider. So these are things like infusion therapy, durable medical equipment, and laboratory tests performed on an outpatient basis. And for anybody that needs physical therapy or chiropractic services, you have $1,000 per covered person that you can use towards that specialist cost. And if anybody needs to ride in an ambulance, you have $2,000 that you can use towards that ambulance cost. Very important to keep in mind, gap insurance does not cover primary care physician's visits, specialist visits, or prescription drugs. And whenever you are receiving services, always make sure to have both your United Healthcare card and your Transamerica Gap card to make sure that your claims are being processed correctly. If you have any issues with processing claims or you have any pushback from the office, feel free to reach out to any of us on the Brown & Brown team. We have a contacts page at the end of the presentation where we can assist you with any billing issues or claims issues that you may have throughout the year. We also have some additional savings accounts. So these are pre-tax savings accounts where you can put money aside to strategically save for certain services or for certain things throughout the year. There's three different options available here. We have a flexible spending account. So you can contribute to this account to pay for any medical costs as well as many over-the-counter medications and items as well. Something important to keep in mind with an FSA is that these dollars do not roll over year to year. There is a minimum amount that can roll over, but for the most part, this is a use it or lose it account. So always make sure that whatever money you put into this account, you are utilizing. We also have a dependent care flexible spending account. So this is a pre-tax savings account that you can use for any eligible dependent care expenses. We also have commuter benefits. So this is a savings account for employees that want to put money aside for commuting expenses, such as transit passes, as well as parking fees. So any of these accounts, you can open and start putting aside money. And the great advantage to utilizing accounts like these is that you lower your taxable income. Very important to stay on top of our preventative care. For anybody that is interested in learning more about preventative care and what they may qualify for, we have a website here, the linked at the bottom of the page, the health.gov/myhealthfinder. You can put in your age and your sex and see what preventative care you may qualify for. These are things like your annual wellness checks, your blood pressure checks, diabetes and cholesterol tests. Depending on your age, these could be also cancer screenings, including mammograms and colonoscopies, as well as flu shots and other vaccines. So I highly recommend checking out this resource here and having those conversations with your doctor. So there's a lot of information that is available out there. It can be a little bit confusing, a little bit daunting, but the responsibility does fall on us as the medical care consumer to make sure that we're utilizing all of the information available to us the best that we can. So we have just some general tips on being a better consumer, as well as a chart with some examples of where you might want to go for certain services, as well as some really important information in regards to pharmacy discount programs. So there are things like CostPlus as well as GoodRx, where you can save money on your prescription drugs. We're also moving to United Healthcare for the dental insurance. So here we have the DHMO plan. This plan is only available for Florida residents. So if you are outside of the state of Florida, you are not able to enroll in this plan. You're only able to enroll in the PPO plan, which is going to be on the next slide. But for anybody within the state of Florida, this is the DHMO plan. You always have to stay within network on this plan. And also every service on this plan has a diagnostic code attached to it. So each diagnostic code has a co-payment, so you know exactly how much you're going to pay depending on the services that you receive. There's no maximum on this plan, so if you know that you are going to accrue if you need a lot of high-cost dental services throughout the year, this might be a good plan option for you. And there's also orthodontic services covered for both adults and children on this plan. Once again, you always have to check if your dentist is within the network if you select this plan. Here we have the dental PPO option. This is the plan option available for those living outside of the state of Florida, as well as those who want a bit more flexibility with their network. With this plan, you have both in and out of network benefits available, but we always recommend to stay within the network whenever possible. On this plan, you do have to meet a deductible. So for individuals, that's going to be $50, and for families, that's going to be $150. Your annual plan maximum, if you stay within the network, is going to be $5,000. So once you reach that total amount on this plan, you max out of the plan for the year and no longer receive coverage until the next calendar year. For preventative services, the plan will pay 100% of the cost of these services, and the deductible does not apply. For basic and major services, you do have to meet the deductible before the plan begins to cover the percentage of the cost of services. And orthodontic services are available. It covers 50% of the cost up to $1,500. If you need to check if your dentist is within the network, we have instructions on how to do so on the page here as well. We also are changing to United Healthcare for the vision insurance. This plan will be utilizing the Spectera Vision Network. Like with all the other plans, you have both in and out of network benefits available, but you're going to hear me say it again. Please always stay within the network whenever possible. If you stay within the network, most of the services will follow a co-payment schedule. So things like your eye exams, as well as standard plastic lenses, will be a co-payment. And for things like frames or elective contact lenses, you will be receiving an allowance to help cover the cost of those items. If you have medically necessary contacts, they will be covered in full after the $15 material copayment. The frequency that you can receive all these services is once every 12 months for eye exams, eyeglasses, or contacts, and once every 12 months as well if you need frames. There's also some additional in-network discounts available. So if you need additional pairs of eyeglasses or prescription sunglasses, as well as LASIK laser vision correction, there are discounts available through this plan. If you need to check if whatever provider you're seeing is within the network, you can check through the uhcvision.com website, or you can call the number listed on this screen. There is a really great benefit that you have as employees of Hamilton and Miller is there's an employer paid basic life and AD&D insurance. This is a free policy available to employees. The amount that you receive on this policy does depend on your job class, but there's nothing that you have to do to enroll in this policy. What we ask of you is to make sure that your beneficiaries are correct and up to date in the Employee Navigator system when you're doing your open enrollment process. If you would like to purchase additional life insurance to have additional financial security and peace of mind, there is voluntary life and AD&D insurance available for purchase. There are policies available for yourself as the employee. There are policies available for your spouse as well as your children. And just the same as with employer paid life, with voluntary life as well, please make sure that your beneficiaries are correct and up to date in the system. You can update this during the open enrollment process as well as any time throughout the year. There's also disability insurance available. There's short-term disability as well as long-term disability. Disability insurance helps to protect a percentage of your income if you are unable to work for a period of time due to disability. Short-term disability is the same for all job classes, with a maximum benefit of 60% of your salary of up to $2,000 weekly. This could be due to accident or illness and will begin on day 8 of disability, and this benefit will last up to 12 weeks. Long-term disability, it depends on your job class, but it does pay 60% of your monthly salary, and the maximum depends on if you are an attorney, director, or shareholder, or if you are another job title within the company. This could be due to accident or illness and will begin on day 91 of disability and can last up to normal Social Security retirement age. There's also additional services available through Mutual of Omaha. And since everybody is automatically enrolled in the employer paid basic life insurance, you automatically have access to all of these great services. We have another employee assistance program through Mutual of Omaha. So you have your counseling sessions that you can take advantage of through United Healthcare, as well as 3 counseling sessions that you could take advantage of through Mutual of Omaha. Please take advantage of these services. They are free, they are confidential, they are available 24/7. If you're going through any issues in your life and you need support, you need help, do not hesitate to reach out to these programs. These counselors are trained, they are licensed, and they are here to help you with whatever you need throughout the year. We also have will preparation services. So if anybody needs help starting the legal documents with wills and trusts and things like that, this service is available to assist you throughout that process. We also have identity theft assistance. So if anybody has any issues with identity theft, with fraud and things like that, this program will assist you with the start of that process. We also have travel assistance. So if you are traveling abroad, it can be a bit daunting, a bit nerve-wracking to leave the country, especially if you're going somewhere where you don't speak the language. Travel assistance can help you with documents, can help you if you lose your bags, if you lose your passport, any issues regarding traveling. This program is available to assist you, and there's a phone number available for inquiries within the US as well as a phone number outside of the US. And with that, I will be passing it off to Alex.
Hi, Gabby. Thank you so much for the time today, and thank you all at Hamilton for your time. The supplement insurance is going to be brought to you by Colonial Life. We are the supplemental providers for Hamilton and Miller. Most of you who have our plans kind of understand the process. This is a supplemental plan. It actually pays you money directly So it doesn't go to the hospital, it doesn't go to the hospital or to the provider. It goes directly to your pocket, and in turn, you can use that money for however you like. We have three different options that are completely independent from the medical plan. So whether you, your spouse, or your children are on the medical insurance, you can still tap into these benefits, and there's specific costs based on the coverage level chosen as well as your age. The three plans we're going to be talking about today are the hospital indemnity insurance, accident, and critical illness plans. Gabby, if you don't mind going to the next slide. Thank you. The first plan is the hospital indemnity protection plan. You have an amazing medical plan. You have great gap coverage. This is there to kind of fill the gaps of anything else that's left. As Gabby mentioned on the gap plan, depending on your coverage that you select, there may be a deductible under that option. This hospital indemnity plan is going to pay you $1,000 up front for hospital admission. It's also going to pay you $500 or $1,000 for outpatient surgeries. It's going to pay you $250 for diagnostics, additional benefits for doctor's office visits, emergency room trips, ambulance and air ambulance rides. So that is there for you. And again, that's dollar first coverage, meaning that the moment you experience an out-of-pocket cost, it's going to pay you for that service. And in turn, you could use that to pay any bills or anything else that you have going on. The hospital indemnity plan does have a option to add children up to age 26. Whether you're in the US or you're traveling, this will cover you for any hospital visits or any subsequent services that you have due to hospitalization, emergency rooms, so on and so forth. And again, this is $1,000 for admission, 500 and 1,000 up to $1,500 per year for outpatient surgery, 250 for diagnostics, and then for doctor office visits, it's $25 per person, up to 3 visits a year per individual, or 5 visits for the family in total. The emergency room trips are $100 for up to 2 trips per year per person. Thanks, Gabby. If you don't mind, go to the next slide. Thank you. Critical illness insurance is a living life insurance benefit. So God forbid you are diagnosed with one of the illnesses on here, including heart attack, stroke, kidney failure, coma, loss of hearing, sight, speech, stroke. Think of this as a living life insurance benefit. So you choose an amount from $10,000 up to $50,000. And God forbid you're diagnosed with one of those conditions, you're paid up that benefit in full. So if I had a $20,000 benefit and I had a heart attack, that full amount is going to me upon diagnosis. And then God forbid if I do pass away, that would go over to my beneficiary. So again, that critical illness is there to help you with those major illnesses and focus on recovery. And again, it's there for diagnosis specific. So you don't have to be hospitalized or anything else. As long as you have that illness and you're diagnosed, that you will be paid out for that benefit. Right below that is the accident insurance. This is a great plan, especially if you live an active lifestyle or have kids who are in sports. This pays for injuries both on and off the job for any accidents, not just car accident specific, but again, if your children are playing sports and they get hurt, this is going to pay for the injury, any treatment, any follow-up treatment, so physical therapy, anything like that that's needed. And then depending on your injury, it's going to actually pay for the injury itself. So I'll use one of my stories. I have a 4-year-old daughter who decided to jump off the couch. She missed her landing and we had to take her to the emergency room. This plan actually paid for the ER visit, the medical imaging, and then the subsequent doctor's visit that followed. So again, it's there to pay me directly, and it actually paid my co-payment, and I had money left over, which again I keep from there on. As mentioned, this is a worldwide coverage, so if you're traveling, something happens, please bring a bill back, and we'll be happy to help you with that. One thing I want to point out is that if you have our plans and you've done any claims or anything in the last year, if you had any issues, please feel free to reach out to us. We'll be happy to help. It's a very simple process. You can go online, submit your bills, and fill out a quick claim form that they ask you what happened. From there, you upload any documentation and Colonial pays you. But if you haven't filed a claim from before, there's still time. There's no time limit on that. So please feel free to reach out to and we'll be happy to help you in that process. All the rates will be loaded into Navigator, so once you go on and enroll, you'll be able to select those coverages, and if you have existing coverages, those will show up in the benefit menu as well. Thank you, Gabby, so much. I appreciate everyone's time today.
All right, thank you, Alex. Moving on to another one of the new offerings this year, we are offering spot pet insurance. So for anybody who has a furry loved one at home, you are now able to take out a policy through Spot Pet Insurance if you'd like to do that with your employer. Spot Pet Insurance offers policies that cover accidents as well as illnesses, and there are additional wellness benefits available. And if you'd like to find out more, we have the link to the Spot Pet Insurance listed here on the page, or you can call this phone number listed on the page as well. For anybody reaching the age of 65 and needing to know more information about Medicare, or anybody who wants some additional support throughout this transition time, we do have a contact through Blue Zone, Mercy del Castillo. She is the go-to contact for anything having to do with Medicare. So if you have any questions, comments, concerns, or needs throughout this time, she is your go-to contact. So we have her phone number and email listed here on this page. Here we have the employee deductions. So these will be pre-tax biweekly deductions depending on what benefit you choose, as well as if you enroll with just yourself or yourself and any dependents. This is just an example of what things will look like for your deductions, but when you are going through Employee Navigator and selecting all of your benefits, you will be able to see the total deduction per paycheck. This is just a highlight so that you have a bit of an idea of what things might look like before you go into the platform. It's also very likely that you may have questions throughout the year. You may need additional support. We do have your human resources contacts listed here on this page, as well as your dedicated Brown and Brown team. Your Brown and Brown team, we are here to assist you with absolutely anything throughout the year. A very important contact that I'd like to highlight is Swanee, your claims advocate specialist. If you have any issues with gap insurance claims, medical claims, dental, vision, any kind of claims or billing issues, she is your go-to contact. Also, I want to stress again that open enrollment does close on December 5th. That is the last day that you can make any selections or changes to your benefits. So please, if you have any questions, if you need additional assistance, you're confused about something, please reach out and get the support you need to make sure that you are making the correct choices on your benefits before the system closes. There's a flyer that either has been distributed or will be distributed soon where you are able to schedule a virtual visit with a representative if you would like any support to go through the enrollment process or you have any questions. There will also be an on-site visit on Thursday, so there will be representatives available in office where you can ask questions, get help with enrollment, anything like that. Also wanted to highlight that if anybody is currently going through medical care or a treatment process with an existing doctor and you go on to the system and you see that that doctor is not covered within the new network, please reach out to us. You can either reach out to Jennifer, Laura, or Christina to receive a transition of care form. This is a form that we need you to fill out if your existing doctor is not within the network for this new plan. So there's a document that needs to be submitted as soon as possible. So please reach out to us if you see that your current treatment doctor is not within the network. Also, please make sure once again that if you have any important maintenance medication to please refill it before the transition into the new plan. We don't expect there to be any delays in coverage, but we just want to go with an abundance of caution and make sure that everybody has the medications that they need in the unlikely case that there is any delay in the transfer of information. And yes, on Thursday, there will be the Q&A, and make sure that before you select the plan, any doctors that you would like to continue seeing, make sure that they are contracted within the network before you make any final selections to your plan. Lastly, we have Benefit Hub. So Benefit Hub is a discount marketplace where you can go onto this website, sign up with your email, and get a world of discounts on travel, sports, local deals. If you want Disney World tickets, hotel discounts, car rentals, anything that you can think of, it is available here on this plan, on this platform. So I highly recommend just going in, signing up, and seeing what discounts are available to you. And with that, I want to say thank you so much to everybody for listening to this presentation. I will be stopping the recording so that if anybody has any questions, they can go ahead and either drop it in the chat or feel free to unmute your mic.